see about the arterial supply of the internal capsule. So step by step we can learn. First of all, we have to draw the 5 parts of the internal capsule. That is, in this manner we have to draw the five parts of the internal capsule. Then the next thing is to draw the arteries. That is, first of all we have to draw a basilar artery and having as if basilar artery is giving 2 branches, such as posterior cerebral and another branch is going. So then anything from the posterior cerebral, any branch from the cerebral is known as communicating branch. Therefore posterior communicating artery comes, then internal carotid arteries are. From the internal carotid we have the middle cerebral and anterior choroidal artery and also anterior cerebral artery. From the anterior, if a branch comes, it is known as anterior communicating artery. So that way we have to draw the arteries. Now we will see the supply from these arteries to the internal capsule. We will see. So to the anterior limb, always anterior cerebral artery will be giving a branch and its name is recurrent artery of Hubner. And next thing, to the genu. To the genu, a recurrent artery of Hubner will be coming and also direct branch from the internal carotid artery will be coming. And the third thing is posterior limb, direct branches from the middle cerebral artery will be coming and supplying the posterior limb. And for sublendiform, it will be anterior choroidal and posterior cerebral. And for posterior limb, it will be alone supplied by posterior cerebral artery. So this way, in this 3 step, we have to divide the arterial supply and it will be easy to learn and draw. Anyway, we have to draw this figure. Next thing is about the clinical anatomy. We can split this into 3 types. Anyway, whatever lesion happens, it can lead to contralateral hemiplegia, and we'll see 3 types of artery can cause a lesion. The first thing is Charcot's artery, which supply the posterior limb. So if posterior limb is affected, then the fibers from the posterior limb will also be affected, leading to the lesions. Next thing is the recurrent artery of Hubner. As we know, recurrent artery of Hubner, it supplies the anterior limb and genu. Therefore, the fibers, that is the frontopondine, the corticonuclear, all the things will be affected, and the anterior and superior radiations will also be affected, and it will lead to lesion. Now, the third artery is the anterior choroidal artery. We know anterior choroidal artery is giving only to the sublendiform part. Therefore, the sublendiform part, temporopondine and parieto-pondine will also be affected, and all the way it will lead to a contralateral hemiplegia. So this is a clinical anatomy of internal capsule and the arterial supply, which is a very important part. This is very important. Should never forget this. That is, first of all, draw the part, then draw basilar artery, then draw the posterior cerebral, then its branch, then internal carotid, middle cerebral, anterior choroidal, anterior cerebral, its part called anterior communicating, then the artery is supplied to the different parts of the internal capsule. That is very important.